My name is Curtin. I'm the site director of the Peterborough Kawartha site, which was a new Queen's site that opened in July 2010 with our first 4 residents. We now have 10 residents on site, and in July 2012 we'll have 6 PGY1, 6 PGY2, so 12, and that'll be our maximum. I'd just like to echo some of the comments that Dr. Schultz made at the beginning, that I think it's a fantastic time to consider a career in family medicine. Family doctors are happier now than they have been in many, many years, particularly within the family health team model. I think people are feeling very well supported and very well rewarded. As far as the Queen's programs go, I can assure you that all of the sites, the curriculum has been worked and reworked, and really a tremendous amount of work has gone at all the 4 sites into making curriculums that are innovative and that are exciting and that meet resident needs. And having just come through accreditation, you can be confident that every facet of the program has been really looked at under a microscope and has been validated as being successful for residents. So, I'd like to talk to you this morning about the community of Peterborough, some of our program highlights, and our hybrid horizontal curriculum. You'll see photographs of some of our happy residents. There's the happy resident theme again. We never show you the exhausted residents. And I think you'll just see reflected in their faces the balance of service and learning that they were able to achieve in the Peterborough site. The burning question many of you may have at this moment is, where is Peterborough? So this map shows that Peterborough is, if not the centre of the universe, it is in fact the centre of southeastern Ontario. It's about an hour and 15 minutes from the eastern border of Toronto. It's 45 minutes from Oshawa. It's just over 2 hours to Kingston, 3 hours to Ottawa. It's home to many professional refugees from the GTA. So there are many people who had the big city career, who contemplated the big city career, but rather chose to live in a community that was a smaller community, a slower pace, a 5-minute walk to work, a 45-minute drive to the door of their lakeside cottage in the Kawarthas. Peterborough is a small city of a population of about 78,000. It's, if for boaters, situated on the Trent Severn waterway, and is the gateway to cottage country in the Kawarthas. It's the home to Trent University and Fleming College, so Peterborough tends to have a more vibrant art, music, theatre community than you would expect for a city of its size, because it's really invigorated by the student population that live in Peterborough. And really, all amenities are at your doorstep. In summer, Peterborough is a big paddling community and a big running community. For people that are into triathlons and Ironman, there's a huge running community as well. There's a Dragon Boat Festival, an international Dragon Boat Festival that's held in Peterborough each year. And in winter, it's a skiing community, and like many small town Ontario communities, it's also hockey town. For hockey players, you'd be aggressively recruited by the Dock teams to play with them, and if you're an OHL fan, the Peterborough Petes are always there for your viewing enjoyment, and learn about concussions and head injury management. So some of the highlights of the program, when we designed the program a few years ago, we were really in the fortunate position of being able to start from scratch and say, what would a great program look like that would draw on the strengths of the medical community and the facilities that are available in Peterborough? So we were able to design what we call a hybrid horizontal program, where the family medicine experience runs horizontally through the 2 years, but the specialty rotations are organized into 4 or usually 8-week blocks. So the theory is that you're a family medicine resident and everything that you do for the 4 or 8 weeks is really brought back immediately to your family medicine patients, but that's the focus and the core of your training program, is the relationship that you have with your 2 primary preceptors that runs through the whole 2 years, and with your patient population that you follow over the 2 years. All residents are placed into community family practices, so rather than being in a family medicine teaching unit, Residents are actually placed in, all the family physicians in Peterborough work within family health teams. Peterborough was an early adopter of the family health team model, so every family physician in Peterborough is part of a family health team. All residents are placed with 2 preceptors that usually work within the same family health team on the same EMR, most often in the same building. And there are 3 half-days per week that are spent with your family medicine preceptors, usually 1 half-day with one and 2 with the other, but that's flexible as the 2 years go on. All the practices are within Peterborough or just on the outskirts. The outskirts of Peterborough might mean that if you drove from the hospital to the practice, it would take you 11 minutes. The specialty experiences are organized into these 4 and 8 week blocks, and they all take place in Peterborough Regional Health Centre. It is, as Dr. Schultz said, a brand new, beautiful facility. It's a large facility. It's a regional referral centre, so it's a stroke referral centre. It has all specialty services except neurosurgery and cardiac surgery. It currently doesn't have primary PCI, but that's coming in the next year or so. It does have a cath lab. It's a busy emergency department, and I think residents appreciate being able to do so much time in the Peterborough Emerge where they really get great experience. And we've organized the rotations such that some of the core experiences repeat in first year and second year. So I think you can all imagine the scenario by which you would do Emerge in your first 2 blocks of first year and then never be back to that experience again. It's less likely to imagine considering that into your eventual practice. In this way, you have an opportunity to be back in the same department, working with the same preceptors and building on your first year experience, building competence, taking on added responsibilities. There are many rotations that have strong family medicine leadership. We have a fairly unique clinic in Peterborough called the Partners in Pregnancy Clinic. It's a maternity care and newborn care clinic that follows newborns, so antenatal care and then through to 6 weeks postpartum. It's run by 5 family doctors. It is its own family health team, in fact, so it has a multidisciplinary approach. And the obstetrical experience in Peterborough is a first-year horizontal 8-week experience that's a traditional gynae and labor and delivery experience, and then a 4-week horizontal second-year experience that's with this low-risk family medicine-led maternity care clinic. Almost in every case, the Peterborough Kawartha family medicine resident is the only learner on the rotation. There are a few clerks that come from Queens on a regular basis to Peterborough, but for the most part, no matter what rotation you're on, you're the only learner, and it's one-to-one teaching with an experienced preceptor. Our program has only been open as a full family medicine residency site for just it'll be 2 years in July. But Peterborough has a long history of accepting learners in the obstetrical department. They've taken Queen's family medicine residents for over 25 years. And the same is the case in many departments. So these are experienced preceptors that you're working with. There isn't as much opportunity for teaching in the traditional team sense that you might be accustomed to. So there is not a large team of fellow and senior resident and junior resident and clinical clerk. I think that residents in the Peterborough Kawartha program who are interested in teaching have to find different opportunities. There's teaching of fellow residents. There are teaching of some of the professionals that you work with within your health team. I know the nurse practitioners in my office love the residents because there's a lot of collaboration and teaching that goes on between residents and nurse practitioners. There's a strong interdisciplinary academic program. Every Wednesday afternoon throughout the program is reserved for teaching that is partly led by family physicians and is based on small group problem-based learning modules that many of you are familiar with. Some of it is taught by specialist local experts. Very little is video conferenced. It's all delivered on site, and we have an administrative house that's about 200 meters from the hospital. That's a lounge, social, teaching, administrative site for the program, and that's the hub of activity on Wednesday afternoons. There's a journal club that's led by one of our local ICU docs. That's quite a rigorous evidence-based medicine component of the program. And our evaluation methods are shared with all the Queen's sites, but the online portfolio system and the academic advisor roles are very strong. And our Peterborough Kawartha residents do tell me that they feel part of the greater Queen's residency family. The events that are in Oponto and up in Temagami at Wanapitei, and about 4 times per year that they come back to Kingston for sites, they do feel that they meet the other residents and they're part of the social aspect of the whole residency, but they really identify as this small group of 10 to 12 Peterborough Kawartha residents. So visually, the first year looks like family medicine clinics running 3 half-days a week through almost the entire year, and then mostly 2 blocks of these other experiences that would take place the other 3 days or 6 half-days of the week. The way that we organize it is after match at the end of March, we send out notices asking which of these 6 streams would you prefer, everyone doing the same rotations but in different orders. And residents last year ranked the streams, and all of them got their first or second choice as far as what order they wanted to do their rotations in. The way that we do the family medicine preceptor match is there's a bit of a sub-match again after match day. Our 6 PGY1s are given an opportunity to say if they have a particular interest in emerge, palliative care, long-term care, obstetrics, and we try and match you with family medicine preceptors that may enhance or reflect some of those interests. There are really very few family doctors in Peterborough who are the truly comprehensive family doctor. There are very few people who do everything. Most family doctors in Peterborough have another interest area. They have their family practice and they work in the emergency department, or they work as hospitalists, or they deliver low-risk maternity care, but there are very few physicians who actually do everything. I think the way that you will work in Peterborough as a family medicine resident is quite reflective of the way that most of us work in real-life practice in a city the size of Peterborough, that we don't try and do everything, but that we all have an interest in another area outside of clinical office medicine. In the second year, there are 3 months in a rural family practice, and that's flexible as far as which communities you'd like to go to. We have access to all of the same communities that Dr. Schultz and Hodgetts have referred to as far as the Kingston sites. We've had residents so far go to Lindsay, Bancroft, Moose Factory, Alliston, and really the choice there is up to you. Our electives are spent 1 block in Peterborough, where you maintain your family medicine experience, and 1 block of elective per year you can leave Peterborough. No one really has. Everyone so far has chosen to stay in Peterborough because there are so many options for elective experiences in Peterborough that almost everyone has chosen to take that second elective and stay in Peterborough. And in fact, most of the residents have chosen to maintain their family medicine half-days during that second elective. I think people really value that time coming back to their home clinic and seeing the patients that they're responsible for, and most of them have chosen to maintain that even when they were able to leave. Oh, look at that. So I think that this is probably clear from what I've described already, but in the 13 blocks per year, we've divided each 4-week block into 10 half-days per week. You spend 3 half-days in the 2 family medicine practices, 1 half-day in academic teaching, 6 half-days with the specialist experience. There's 1 block in PGY1 when you could not do the family medicine experience, and that would be the elective that you could choose to go out of town. In the PGY2 year, there are more blocks where you would not have your community family practice experience, 3 of which you are out of town doing a rural rotation full-time, 1 of which is a full-time internal medicine inpatient experience, and 1 of which is the elective block that you can choose to be out of town. So what it looks like is if you were doing pediatrics or care of the child and adolescent, you would be doing the 3 family medicine half-days, which are the blue. You'd be working with several different pediatricians, both in the hospital and in their offices, as well as specialty clinics like diabetes clinic, and there's a 5 Counties Children's Center in town. And you would do on-call with the pediatrician who was on call that day. Most of the call, with the exception of obstetrics in Peterborough, ends at 11 p.m. So the call in obstetrics is the traditional 24-hour call with the next day post-call. The rest of the call ends at 11 p.m. because the learners felt at the outset of the program that there was really very little learning that went on beyond 11. It's still a regional health center, and often patients are held in the emergency department until the morning. So residents felt that there was little learning going on overnight, and then it impacted their learning the next day. So So we've chosen to have call end by 11 so that you could maintain your clinical experiences the next day. This is another example during the geriatrics rotation where there's no call, but the experience is split between some long-term care experience, some memory clinic with geriatricians, some interdisciplinary clinics with geriatricians, psychiatrists, some emergency room follow-up clinics at the hospital. So the last thing that I'll leave you with is that we made a short 90-second video that was kind of showcasing some of Peterborough and some of the hospital, and I would be happy to take any questions during the break. Thank you.